George Brenner. He is a licensed clinical social worker, a licensed marriage and family therapist, and a licensed clinical addictions counselor. And he is a MINT trainer.
Member of MINT.
Member
That's
of
a
MINT.
technical question. That's a technical issue, yeah.
He does motivational interviewing.
There you go.
And he's going to talk about motivational interviewing this afternoon. And I am very pleased and honored to present to you my friend George Brenner to do your afternoon first session.
Okay, thank you, and appreciate it. So I was reminded of several things this morning. There's a reason why I'm interested in gambling. I grew up Catholic. There are a number of dead goldfish out there who were unfortunate enough for me to pitch the ping pong ball into the bubble. And this is a geography lesson. I grew up in Evansville, actually a farm north of Evansville. So as a fluke of nature, the Ellis Park is on the Indiana side of the river. So Ellis Park was part of our presence. And then, of course, lastly, I was destined to end up a University of Evansville graduate where the mascot is a riverboat gambler. So again, just sort of flukes of nature here. One, I always start with affirmations. It's an important element of motivational interviewing. And so I want to acknowledge your courage and your compassion to work with folks who struggle with a variety of issues. I won't call them disorders for a good reason. But I want to acknowledge the strength and the courage and the compassion that it takes to work with folks who are struggling every day. The other thing is part of motivational interviewing, the spirit is compassion. MINT is an international organization. And so I would like to take just a moment, a couple of moments of silence, and out of compassion, be concerned about the folks who are struggling with war currently and their own private battles. So if we could just take a few seconds and send some positive energy. Thank you for that. How many of you have been trained in motivational interviewing? Okay, so most of you. And so Ronson Lynn and Mike asked me to do something a little different, and hopefully I'll accomplish that today, which is a lot of us have been trained in motivational interviewing and kind of say, well, what does that really sound like? How do we do it strategically with folks with gambling, people with gambling disorders? Hence the title, Strategic Use and Integration with Problematic Behaviors. You notice I don't use a diagnosis. Motivational interviewing does not treat a diagnosis. Motivational interviewing works with people who are struggling with behaviors associated with gambling, no matter what type of gambling is that. Now, most of us would like that our progress is linear, like going up a step, but you'll notice even the graphic suggests that some people never get well. And for most of the folks who even get well, who do improve their condition, in fact, have issues along the way. There are about 1,800 studies now, and probably more, regarding motivational interviewing. It's one of the most researched evidence-based practice. And most of the research now in motivational interviewing is not actually MI. I'm currently involved in some research at IU School of Medicine. It's actually a CBT study where everybody's being trained in MI. That will never show up in the literature, even if it's effective. And so most of the reason I point that out is that motivational interviewing is primarily used as an integrated model in the research now. And so when we talk about folks who are working on the crisis line or SBIRT or CBT, it's integrated in the work we do. There's a body of research in using MI integrated with suicide prevention. And so it's important to kind of think about MI in that way. This is consistent with the third edition of motivational interviewing. So if you were trained a long time ago, particularly prior to 13 or 14, you may have been trained in earlier concepts. And I will give you, if we have time, a couple of sneak previews of what will likely be in the fourth edition in 2 years. And Curtis, I'm hoping I will retire in those, fully retire, so I don't have to change my PowerPoints once again. So at any rate, this is third edition consistent. Again, what we're going to do is what I sometimes refer to as saxophone lessons. By the way, just a housekeeping issue. I answer questions as they arise. Most questions come up contextually. So if you have a question or comment, please raise it, understanding that with time permitting, we probably won't be able to go into some of the weeds of the answers. But I do, if you have a question or concern, please raise those. So this is a saxophone lesson with maybe some, if we have time, what's called deliberate practice. That's the way we develop competence in MI. And the reason I use that concept is in my training, my daughter, Ronson, my daughter took saxophone lessons in grade school and middle school, and she will firmly say she's not a saxophonist because she didn't practice. And so one only becomes a saxophonist. Now, always to remain strength-based, though, she found out her instrument with a stethoscope, and I think she will be an excellent pediatric physician. So it's a good alternative to a saxophone. It probably makes more money, too, than most saxophones. Anyway, so this is really about learning. Today, what we're going to try and do is think MI, not do MI. And so we're going to try and do this within the context and learning how to maybe talk about how to integrate it. Bill Miller says most people who need to make a change are ambivalent about doing so. So for you, Sarah on the crisis line, people call. I need help with gambling. And you refer them, and they say, well, I don't need that kind of help. So most people who need to make a change, even if they come into treatment, or frequently people will come into treatment saying they have a problem with someone's hand firmly placed in their back, pushing them in. It's somebody who's pretty unhappy with the way situations are related to gambling. Or maybe it's a parent who's concerned that the person is spending too much time playing games, etc. So even the people who, quote unquote, seem motivated are often ambivalent. And we will talk a little bit more about what ambivalence means here in a minute. Foundations. So we're going to talk about the foundations of MI and how they relate to gambling. Gambling is, conversations in MI really go back almost to the beginning of the history. You'll see Bill Miller making references to gambling conversations in MI. So I always think about Legos when I think about foundations. My son played with Legos, giving equal opportunity to both kids. And I think about learning how things fit together is important. It may have influenced why he ended up becoming a mechanical engineer. He likes to figure out how things go together. There are actually 3 definitions of motivational interviewing. And so I only focus on the first 2 in this type of training. The layperson, meaning, again, what if a person's receiving motivational interviewing? What is this about? Well, it's a conversation, isn't it? In fact, Bill Miller said if he had to do it over again, he probably have called it motivational conversations, because a lot of times when we think about interviewing, we think about a Q&A session, and this is not Q&A, it's a conversation. And what's that conversation about? The conversation is about that person's motivation and commitment to making a helpful change. What are we doing? And I changed some of the words. I put in the word caregiver, because motivational interviewing is not just talk to counselors, it's not counseling. It's really a person-centered, so it's about the individual. And it's designed for one purpose, and that primary purpose, and that's to resolve that person's ambivalence about change. If the person's highly motivated, how many of you would like to only work with highly motivated people? And how many of you only work with highly motivated people? And if they were that highly motivated, they probably wouldn't need you. And so they'd be doing it. And so the idea here is that the conversation, this is a person-centered conversation to resolve the common problem of their ambivalence about not gambling, or about taking better care of themselves, or whatever associated problems, managing their finances. So it really is about resolving the common problem of ambivalence. Now, I would hope that all of you would answer first question, yes. Do clients with problems related to gambling, have the capacity for change? Capacity is not the same. Otherwise, I have I've done supervision over the years, and there have been occasionally a person, and you've done supervision on something, occasionally you run into that person, you say, you know, why did you choose this profession? Okay? So the idea here is that, yes, by the way, I normally walk to the back, but they put this little line, and it's like one of those shocker collars. If I go out of this lane, I'm going to be shocked because that's the only way the video catches me for the folks who are not here in person. So if I want to do this, it's only because I can't go there. So they have capacity is different than will. Will I change? And what we want to do is increase the capacity. People are values-based, and they make changes or behave or act on those values. It's important to recognize that gambling or gaming is values-based. And it's important to understand the unique values that it represents. It's the way they manage their depression. It's the way they forget about their problems. It's the way that they entertain themselves, get excited, distracted from day-to-day routines. A PhD student I worked with, it was the way that going to the track and betting horse was a way of kind of not thinking about all the studying he had to do. And so that whole sense of even gambling is values-based. And so the idea here is that in some respects what we have to do is explore the values, the goals, the aspirations of that individual so that they're motivated to act to not gamble or to manage their money or spend more time with their kids, all of those behaviors that are related. And so each person, part of the reason I share that is that these are unique issues. And Bill Miller would say that you know you're doing motivational interviewing if you're listening more than telling. If your clients are actually doing the talking. And so it helps us understand it is not, I am not here to replace. So my metaphor in having a conversation once with Bill Miller is that it plays nicely in the sandbox with other. It's another tool. I am not here to replace the tools you already have. I have, as a person who's done clinical practice for 50 years, I have acceptance and commitment therapy skills. I have CBT skills. I have mindfulness skills. I have a lot of other skills that I bring in. I have, I don't need to go there. And where it is contraindicated is if a person's highly motivated, you don't need me to have a discussion with you. Is it Brooke? Mm-hmm. Yeah. You don't need me to have a conversation about your motivation if you're already highly motivated. In fact, I'd be wasting your time. But the idea is that research tells us about 70 to 80% of our clients are either not ambivalent at all, meaning they really don't see a problem, they're there for somebody else, or they're ambivalent about change. So the research behind motivational interviewing is largely linguistics training. What they did is studied people who change. And guess what? People who change talk about it. They don't just think about it. They actually talk about it. Because a lot of us have thought about a change and never got around to it. It's talking about change that seems to make a difference. So what we want people to do is think and talk about it. We want them to think about the negatives of what's happening in their lives as a result of gambling or gaming. And we want them to talk about it. And what we notice is that people who talk about change are more likely to commit to taking steps. They're more likely to follow up with that referral. They're more likely to follow up with self-exclusion. They're more likely to download one of those apps that people keep talking about, or you're talking about me who always gets my wife's hand-me-down cell phones because I have no idea what's going on. And then people are likely, if they see the benefits, are more likely to change. So motivational interviewing doesn't cause change, Jeremy. What it does is, what we know from research is how I talk to you, the kinds of questions I ask, what I reflect back to you, how I respond to what you say about gambling will directly impact. I can double or reduce by half the number of statements you make that either support change or don't support change. And what are those conversations about? They're about the disadvantages of the status quo. if I keep spending that much time on the computer, my grades will continue to crash, and my parents are on my butt. You know, disadvantage of the status quo, which is I'm about to lose my house. I'm about to lose my relationship. So that's change talk. That increases the likelihood that people will take steps. Or the advantage of change. I'll be able to keep my family. I'll be able to maintain my job. I'll get off probation. So some of these are kind of even external pressure, but advantages of change. Intention to change. In other words, I'm going to do something. I'm going to sign up for something. I'm going to see a counselor for gambling problems. Or optimism about change. And I'm going to spend a little more time about that because it's something that I think we don't talk enough about, is optimism that I can make a change, that I can actually stop gambling, that I can actually pay off my debts. Oh, I know what I wanted to say. The other thing so when we talk about this, is that this isn't just a thinking problem. There's neuroscience research to support motivational interviewing. Because over time, gambling is hardwired into the brain. And what we know is that when we talk to somebody about change, I got to be careful not to get in the weeds too much here because there's a lot of stuff to cover. We not only know that how much we talk about change makes a difference, the actual ratio between change talk statements and sustained talk statements, meaning statements that support continuing to do the same, because you were talking about removing the buts, and I have a slide for that. Is that the more statements, the ratio of change talk to sustained talk actually also in the literature suggests that what we're actually doing is sort of restoring neural pathways or supporting neural pathways in the brain that have been either rewired or sort of confiscated by the gambling behavior. And the other thing I want to say about it is that we all know the easiest thing to learn in motivational interviewing is how to ask better questions, like why do you want to change? Why do you need to stop gambling? And we'll talk more about those in a minute. Don't lose the opportunity. Notice the caricature up there. How many of you have clients who argue with you? Our goal is not to have clients argue with you. Our goal in motivational interviewing is to have clients who argue with themselves. In other words, if you hear change talk, what you want to do is reflect it back. Let them hear their own voice and reason for change. I need to stop gambling to save my relationship. Oh, so you're telling me how important your relationship is to you. And that's why you want to stop gambling. And so that sense of, you know, sometimes we try to, well, I'll get to that slide in a minute. The issue is that we don't want to just ask change talk questions. When we get change talk answers, reflect it back, mirror it back, let them argue with themselves. Because in old school, we used to confront people. My goal is to have them confront themselves, create what we call the value behavior discrepancy. So these are older views. They're in denial. They lack insight. They lack information. And so what we tend to do is try and persuade them, give them information, etc. And in fact, well, and some of that may in fact be true. How many of you like to fix things? In the world of helping, we like to fix things. I want to lose a few pounds. You start telling me how to fix it. In motivational interviewing, we ask the question, why is that important? Why is it important? So we want to be very careful that in motivational interviewing, we only give advice or information or education when it's time. And so motivational interviewing offers another point of view, that it's really about ambivalence. Now, this is the first coaching tip, so I hope you're okay with me coaching as we go through. I talk with my hands. How many of you talk with your hands? So let's all talk with our hands for a minute. So if you don't mind playing along, including the people in the back. All right, let's talk. How many of you hear what Jeremy calls the yabbits? A friend of mine who's also a mint trainer talks about the yabbits. Yeah, I need to change, but yeah, I need to stop gambling, but I need to win in order to get myself out of the current financial bind I'm in. We call those yabbits. Or my friend Mallory calls them yabbits anyway. So I've taken up, we share with each other. Or the other but that we hear is, yeah, but I can't. And we'll talk a little, even more about, more about that. Yeah, I want to, but I can't. How many times have your clients tried to stop gambling or cut back? And so we sort of think about the yeah buts. Or the fact that we, in our world, we think about disparities. I want to talk a little, kind of reframe some of the, I talked about the 1800 studies. Some of the areas in which research supports motivational interviewing improved over other outcomes, over other evidence-based practices. It seems to have a better outcome when working with minority communities, people who are depressed, or folks who've experienced trauma, and I know that you're going to do. It also has a dose effect, and so that sense of yeah buts. And it seems to work better, because a lot of our other evidence-based practices require the person to have some significant motivation to change. So for folks who are ambivalent about change, motivational interviewing has improved outcomes compared to other evidence-based practices in those areas. So the yeah buts. So back to our hands, including the back. All right. So first coaching tip, we remove all buts with and. Because in communications theory, as soon as you see the word but, Jeremy, you will wipe away the first part of that sentence. I need to stop gambling, wipe it away, but. In motivational interviewing, we say and, because the person has both arguments, and we know which part of the argument's winning out at the moment, don't we? So we call them we use double-sided reflections. On one hand, you're thinking about gambling in order to get you out of this financial situation. And, notice the and on the other hand, you've crossed that bridge before and it didn't work. You found it didn't work. So that sense of on one hand and on the other. Notice what we did too with that is that we put the negatives, or rather the sustained talk first and the change talk second. So we hopefully moved that conversation in a very specific direction. So that's a little bit about ambivalence. A little more about ambivalence, though, is that a lot of times we think ambivalence is about importance. That the person just doesn't see it as important enough. And if they saw how important it is, they would make the change. Now, if they're on a crisis line, thinking about suicide, they know how important it is, and you don't have to convince them. And if you have importance conversations, you might even be defeating yourself a little bit. That person's ambivalence might very well be about confidence. Confidence that they can get out of this mess. Confidence that there's a solution. Confidence that there's a tomorrow. And so it's important that we think about importance and confidence. Because again, a lot of times we say, well, the person, again, back to older traditional methods. And so a lot of times the ambivalence really isn't just about importance. It could be both. And we have a solution for that, by the way, or a suggestion for that. And this is where screening, by the way, for those, how many of you use screening tools like GBIRD or something like that? Because that's an integrated practice. It's an integration of GBIRD. For those of you who are familiar with Laura Rugel's work, GBIRD is a kind of a offshoot of SBIRT and whatever, and it usually involves screening along with motivational interviewing to increase the likelihood that person who's not ambivalent starts seeing that they do have some problems and might make some changes. How many of you use scaling? So how many of you after today's session are going to use scaling? Scaling is an important tool we use in motivational interviewing. Because, again, if you're going to be strategic about using motivational interviewing, you want to know, do I need to have importance or confidence conversations with this person? And so it helps us have the right conversation, Ashton, with the right person at the right time. And so I'm not spending my time trying to convince you that there's a problem or having you convince yourself there's a problem. If you're already convinced there's a problem, and the real issue is that you have no confidence that you can make this change. Scaling helps us do that. And yes?
I was just going to say, one of the best things I learned about the ruler is physically having people stand on a ruler.
Yeah, put their finger on a ruler.
No, take the room.
Yeah.
And have them stand, because even if they're facing one direction, the other, or not in any direction, you can process that with the ambivalence.
Yeah.
And the commitment to change, and that was super helpful.
Yeah.
I love this.
Yeah. So again, on a 0 to 10 scale, 10 being most important, how important is it for you to make changes related to your gambling? We usually follow that, and that will elicit change talk. Not always, but if it's working, it'll elicit change talk. And then you follow that, why is it that number and not a 0? I almost always use 0, because nobody wants to be a 0, by the way. And so for psychological reasons. I also use these as affirmation opportunities. So a person who might even say 4, I'd say, so you're 40% there. So as a way of saying you're at least on the road to change, kind of an affirmation. And then after some discussion why they're not a 0, usually ask them what would have to happen in order for it to be maybe 1 or 2 numbers. And I won't get in the weeds of this. In medical research, they say a 7 or higher is actually significant in terms of motivation. We sometimes throw out 10s for a variety of reasons. Then follow that up with Ashton, on a 0 to 10 scale, how confident are you that you can make this change? And that really helps us. So when I think about that, what I think about Sarah is I think about using more affirmations, talking about their strength, talking about successes they've had in the past to make difficult choices as a way of kind of what we call in old behavioral psychology, generalizing information, generalizing success. And so it's important. The other thing you can try that's also I find helpful is commitment rulers. So you've had a conversation with somebody for a while, and you've come up with a plan. Ask them how committed they are to following up with that plan, whether that's excluding themselves. There's, again, a body of knowledge that says if they make a promise to you, Curtis, that they're going to do something, people keep their word. And if they commit to something, they're much more likely to do it if you don't ask the commitment question. And so
how important would you consider time-based or passage of time to that commitment ruler? Some of the callers we get are in the middle of the night or something to that effect. So do you feel like that commitment may change, affect their confidence if they have to wait 6-7 hours before the next place is open to do that? Or?
I'm not aware of any specific research to that question. There is, I think, some research that suggests, and again, this is not MI research, is that anytime you can do a warm handoff, you're better. Right. We're finding that with some of the research that I'm doing on this anxiety research, is that if they have to wait a long time or if they have to jump through a lot of hoops, there's some technology hoops that do make a difference. But that's not MI research that says anytime you can, that whole sense of striking while the iron is hot. Because we know, as you say, that motivation waxes and wanes. It is not linear in the same way that we'll talk about in a minute here. So try commitment rulers. How motivational interviewing is used. Again, and sometimes, I think we sometimes don't talk about this enough, which is that and some of the early research in motivational interviewing is it's used as an initial strategy to get people headed in the direction of change. And it's very effective because, again, if you can, there is, again, a body of knowledge that if I can help you, resolve your initial ambivalence, no matter what you do with me, the likelihood of improved outcomes. And so, as an initial strategy. Fallback strategy. How many of you, once they see you, only get better? And 30 days later, for those of you who have ever been trained and in a training with, what's his first name? Bauerkamp. I can't say it. Jeremy, the financial person, Bauerkamp, right? Yeah. So we all know if you've had financial training related to gambling disorders.
Trying to think of his
Jerry, yeah. Is that 30 days later when the bills start coming in, motivation for gambling increases again because I now have to figure out how to pay those bills. And so fallback strategy. So again, or that people are initially motivated to do some things and not other things. So talking to people about their finances and giving up some of their control about their finances or involving their spouse who they've been hiding their gambling from and the issues is that, so that's a fallback or an integrated position, which is am I in GBERT, am I in suicide prevention, am I in budgeting, am I in a variety of, a lot of you do psychoeducation, and so motivational interviewing integrates very nicely with psychoeducation, and we'll talk a little bit about that. The other thing is that MI is not the 45 or 50-minute hour. A lot of the folks that I work with are not therapists. They're case managers, or they're healthcare workers, and they are probation officers, and they have 15 minutes. And so it might be 2 or 3 minutes of saying, Cheryl, is it Cheryl? You know, Cheryl, why is it important for you to do something about your gambling? And just even a 2 or 3 minute conversation to get you to say it out loud for me to reflect it back will make a difference. So it's not the 50-minute hour. So it doesn't matter if you're a counselor or if you're a peer. I do a lot of training with peer recovery coaches, coaches. So again, it can be brief or an extended conversation, depending on what it needs. Again, for those of you who've seen the literature, and people have already alluded to this, is that people with gambling problems oftentimes, and I noticed that Rosalind, you're doing something on trauma, so I'm not going to do your presentation here. But at the same time, I think it's important that we look at this as we know the likelihood that there's a co-occurring issue. And that it isn't just a gambling issue. There likely is a substance use issue or mental health issue, maybe preceding or as a result of, and I'm not going to go into the weeds. We know that most of the folks that we work with have either had some prior trauma or trauma related to their gambling. And we know, if you can see underneath the bubbles, they aren't as clear there. They have issues with coping skills, legal skills, work. And that's why I say motivational interviewing doesn't treat a disorder. It treats those other, it works with resolving those problems related to. So there could be, it will be conversations about gambling. It could also be conversations about trauma. It could be conversation about abuse. It could be a conversation about, and the only thing that I want to say further about that is if you are, what I just did, and this is not a comprehensive one, which is looked at what is required for trauma-informed care and services and looked at some of the elements of motivational interviewing that correlate with that. And so, in other words, if you are providing motivational interviewing, you are providing trauma-informed care. It is one of the methods. Now, motivational interviewing, for those of you, again, a lot of you have trained, know that it's things that you already do that come natural to you. The spirit of motivational interviewing, 50% of the effect of motivational interviewing is relational, the kind of therapeutic or professional relationship you have with clients. The other thing is we want to think about the 4 processes. How many of you, and I'll talk a little bit more about that in another slide, how many of you have noticed with your spouse, your kids, or whatever, that after about the first minute, and maybe even if you're really astute before the first minute, you're kind of starting to say to yourself, maybe I might as well just be talking to myself. So you've had that experience, have you? I don't know that I've ever had it. I read about it once. No. Yeah, it's a normal experience, engagement. You can't have a conversation with change unless the person's engaged. And so we really pay attention, and I'll come back to this later, is that we think about the 4 parts of a conversation. And we think about the skills, open-ended questions, affirmations, reflection, summary, and advice only with permission. And I'll talk about specific applications of those to gambling disorders. And moving people from what we call preparatory change talk, which is, I'd like to do something. I'd like to lose 15 pounds. Or rather, my joke is, I like to lose 10 pounds. And with COVID, it's now 15. We all like to do a lot of things. The idea is that it's important for us to listen for preparatory change talk. And the more preparatory change talk we get, the more likelihood that people are likely to commit to change. So briefly, we know what the spirit of MI looks like. And sometimes it's hard for us to maintain that. Do our clients make some pretty unexpert decisions? And the answer is yes. Although I've been known to make a few in my life. Partnership. Partnership means that we honor the client's expertise and perspective, and their unique perspective. Because any solution we have to come up with has to consider what resources the client has within their own environment, financial resources, etc. So partnership is critical. So we're not telling them to do something. We're engaging them in a collaborative relationship. Acceptance has 4 elements. Again, absolute worth. Sometimes our clients do things that we find offensive, and so we kind of have to watch how we respond to those. Is that we are able to separate the behavior from the person. Accurate empathy is critical. And in motivational interviewing, accurate empathy is not that my experience is your experience. There is no 1-day, 2-day, or 10-year training, Ronson Lynn, that I could go to that would ever help me understand what it's like to grow up as a woman. Ain't gonna happen, no. But that doesn't mean that I can't work with folks who are different than myself. And accurate empathy is really the skill of reflection. I reflect back what you say. When you tell me what your goals are, Cheryl, I reflect those back. You care about your family. Yeah. Oh, I'm sorry. Gotcha. Thanks for the coaching. So accurate empathy. Autonomy. Our clients, so I saw in, I think, one of your slides, sorry, your name is Jody, harm reduction. Our clients are fully autonomous decision makers. We all tell our kids, you can't do that. Hell, my kids prove that over and over again. They can do whatever they choose to do, independent. Hopefully they consider my opinion. Our clients are autonomous decision makers, and we have to fully accept their ability to make autonomous decisions. But that doesn't mean we throw our hands in the air. So they may enjoy the entertainment value of gaming or gambling, and at the same time, they want to keep their family, or they want to pay their bills. And if those aren't in sync, then, so we have people explore what their different values and hopefully decide of a helpful change wins out. Compassion, again, something all of us are kind of come naturally for those of us in our position. And sometimes our compassion is not for our clients. Our compassion is for the families who've been damaged or affected by them. Or how many of us have had that day where if I hear one more crisis, Sarah, I'm just going to scream. I cannot, my tank is full of sad news today. And so that whole sense of it's hard to maintain, and compassion becomes important. Evocation, it is not motivational interviewing unless it's evocative. In other words, what we try and figure out, Jody, is what does this person care about? And so what's important? What are their values? What are their goals? What are their dreams? What are their aspirations? Because we want to support that in our conversations. Four fundamental processes. And again, something I think we don't pay enough attention to. You'll notice that how these are stacked. And they're stacked that way for a different reason. By the way, this may change in the 4th edition. We don't know exactly how yet. Again, you can't have a conversation about change unless the person's engaged in that conversation with you, Jeremy. They have to be willing to talk to you. And they have to be willing to talk about something. One of the things that can happen, though, is that we can lose that engagement. Maybe you think the best solution in the planning process is for them to sign up to self-exclude. They ain't interested. Engagement is lost. And so we have to make sure that the eye contact's there, right? That we watch the body language, that we're still actively listening and they're actively engaged. Second process is it has to have focus. It is not, like I said, motivational interviewing doesn't change a diagnosis. It focuses on what behavior change or we're going to work on. Improving your family relationship, not attempting suicide, not going to the casino, putting the computer in a family area so everybody has a chance to see what's going on. So now I'm talking about something I have no clue about, but at any rate, technology. At any rate, it has to be focused. Again, I may lose interest in that focus because now I'm realizing I might have to give up something. Engagement is lost. So again, what I want you to do is think about engagement. And here's a common problem. Again, let's go back to the survey. How many of you are fixers by nature? How many of you, if I told you I wanted to lose 10 pounds, would get out your pad and paper and search how I could go about losing those 10 pounds? Oh, I see some hands. Motivational interviewing is not solution focused. Part of motivational interviewing is planning and thinks about a solution. Not yet. In motivational interviewing, we do the why before the how. I think you said that earlier. We think about the why before the how. Because now you're going to ask George, why does George want to lose 10 pounds? The last time I actually had this conversation is actually after about 4 months into COVID, and I wouldn't have guessed the answer. The why they wanted to lose the 5 to 10 pounds was they weren't sure they would still fit in their wedding dress when the fall came when they were supposed to be married. So again, that's back to each individual reason. Why is it important? That's where the values come in. It is not motivational interviewing unless it's evocative. I didn't say provocative. It's not poking the bear. I have the old school training of where you poke the bear. This is not poking the bear. This is evocative. Why before the how? Because that increases the likelihood that people are on board in a problem-solving fashion. And they're more likely to take that referral. They're more likely to see the financial counselor. They're more likely to involve their significant other in where their gambling debt is hidden. So the 5 micro skills: open questions, affirmations, reflection, summary, and advice only with permission, which is now considered the 5th skill generally. Now, before we go on, though, and I'll talk about each of those individually. Before we go on, though, I want you to sort of think about what motivational interviewing is I don't reflect everything that you say, because if I reflected everything you say, I could, in fact, help you stay stuck. And so Motivational interviewing is guiding and directional. So I'm very selective in the questions I ask. We are selective in our reflections, elaborations, summarizing, and affirming. By the way, sometimes it's been considered, or motivational interviewing has been, I sometimes get this, well, isn't that manipulative? And I say, you know what? If a client doesn't want to go there, they'll tell me. And so I'm never guiding a person in a direction that they're not interested in going, because that would be violating an ethical principle in motivational interviewing, which is compassion to what the client wants, even if they're ambivalent about that. So, again, by the way, there is nothing proprietary in my slides. If you want my slides in person, just email me, and I'll be happy to send them to you. You just have to tell me where you heard me so I know which set to send you. Mint folks are very happy to share stuff, for the most part. So, you know, if you want people, and we talk about the ORs, the open questions, sometimes we've lost the old notion of we also use our ears. E questions are asking for examples and elaborations. Why do you want to stop gambling? Person says, well, I want to get my family back. Tell me more about that is an E question. I'm asking for more. What would not gambling look like to you? And they'll tell me about how they gamble. They'll tell me fairly good detail. So what changes are you willing to make? What are their ideas? It's important that we ask A questions, ability, because a lot of our clients, Ashton, have tried to quit or cut back before, or change how they gamble, or the type of behavior that they are involved in. And so we ask A questions. Now, in the past, we've had a negative thing. Well, you know, half measures availed us nothing, for those of you who've been around a long time, or all your best efforts have gotten you here. We don't go there in MI. Where we say is that, you know what, if we can build on something that you have found to have some success, again, back to the harm reduction model here, which is if we can build on your success and put it in the planning process, the person's much more likely to follow through. And so that sense of, what have you tried in the past to stop gambling? Our clients oftentimes don't differentiate reason and need questions. They're both what we call importance questions. Why do you need to stop gambling? What important? How would your life change for the better if you didn't gamble? What will gambling continue to cost you? And then CAT questions are, what are you committed to do? Always try and remember when you ask a question, and if you hear change talk, remember, Cheryl, to reflect it back. And I wish you had bigger names in the back, because I'd be talking to you too. It keeps you more engaged, but this is the nature of the beast. So whenever you hear change talk, don't lose the opportunity to mirror it back, reflect it back. Always think about asking values-based questions. How would it improve your life? How would it make things better? What do you care about? Creating what we call the value-behavior discrepancy. And these are just some examples of different kinds of reflections. There's nothing comprehensive about it. So the simple reflection is just basically repeating back what they say to you. So I hear you say you want to stop gambling. A complex reflection would be, again, a person say, I want to stop gambling. And they've told you about their relationship. So you're concerned that your partner has lost trust in you because of your gambling. So that sense of looking for a value, reading something into it, making it more complex. Summary is pulling together. We use summaries a lot, which is if sometimes people get very chatty on the crisis line, right, Sarah? You know, yeah, and so thinking about a summary, because again, what you're trying to do is have them see it all as part of a single theme. So you need to stop gambling for yourself and your family. Continued gambling will cause you financial disasters. And now you're constantly worried and panicked, or thinking about self-harm, or ending it. Double-sided reflection. I already gave you an example of the double-sided reflection, which is when you hear change talk and sustain talk in the same sentence. Think about a double-sided. Only notice the and it gets flipped. On one hand, you think a win will solve these financial problems. And you've been down this is actually, by the way, I talk in metaphors a lot. I love metaphors. We all love metaphors. There's a whole body of research on why metaphors work and symbolic language works. And that sense of, as a way of saying, you get me. So you've been down this road before and found it a dead end. So not only is this a double-sided reflection, it's actually a metaphor reflection as well. And so I don't really talk much about amplified reflections because they can come across as sarcastic. And so I don't really, maybe if this were a more detailed advanced training, I'd talk a little bit about the important or the value of amplified reflections. Metaphors, again, gambling has started to become a sausage grinder for you. I love metaphors. This is not a gambling metaphor. How many of you have had that day where you felt like you were the gerbil on the gerbil wheel and you ran your tail off and all you found out you hadn't, by the end of the day, is you got nowhere and you're just damn tired? Did I miss anybody? No, metaphors work and they're very effective as a reflection because they say, you get me, you understand. And this is my symbolic metaphor, and hopefully nobody's offended by it, which is one of my other favorites that I've sometimes used, because you can use metaphor reflections with humor. Humor is a very effective therapeutic tool. You ever had one of those days where you felt like you were swimming in a toilet and somebody just flushed it? So again, a little bit of dicey humor, but again, it can be quite effective. Metaphors. Affirmations. Research tells us, even though, how many of you think yourself strength-based? Research would tell us that we are fixers. And we don't think often enough about being affirmation-oriented. In other approaches, like in marriage and family therapy training, you'll see narrative therapy. Children's services, you see it called strength-based. There are a lot of overlaps. MI is a trans-theoretical model. So the idea here is that even though all of us think about strengths and we think about our client's strengths, when we think about actual tape conversations of client interactions, is we find that affirmations are not indicated often enough. Now, how many of you have worked with clients who are discouraged? Lack confidence they can make a change. That's a cue to say I should be more affirmation. I want to, not should be, I'll try not to use words like should. That I ought to think more in terms of affirmations, helping clients identify their strengths. Affirmations are not compliments. They are comments on strengths, efforts, or intentions. They are statements about the person. And a lot of our clients, in fact, borrow their hope from us. If you want to see some research in terms of substance use disorders, it's one of the earlier researches outside of MI in terms of how our hopefulness in our clients being able to do well is the Harp Study. And I won't go into any detail there, but there's a lot of research. By the way, if I could recommend a book, and it's written by Bill Miller and Teresa Moyers, it's not motivational interviewing, but they are key researchers, obviously, in motivational interviewing, is called Effective Psychotherapist. It talks about the 8 characteristics where evidence supports, if they're all able to be learned, and where there's significant research that directly correlates. So for those of you who supervise folks, I would encourage you to read that. It just came out last year. Or my punchline is, and I've heard this punchline before, which is, you can read that book or just do MI. So, because MI pays attention to it. One of the new developments, and I, again, won't, because of the amount of time, I won't go into, is that one of the developments in motivational interviewing is that just as in reflections we think about simple and complex reflections, the new iteration will look at simple and complex affirmations. And what the new version or the kind of newer version would be tying the behavior change to a specific strength that you have. As I did earlier, which is the strength, your strength of courage allows you to work with folks or helps you work with folks every day. So I could say, I appreciate you working with folks every day, or I could say your courage helps you work with folks. And so what we're trying to do is help people identify their inherent strengths. By the way, there is no official list in regards to this for motivational interviewing. The one that I use is, oh, it's on another slide. I'll get to it in a minute. When's it appropriate to educate? I'm kind of paying attention here. We won't do any practice today just because we kind of running, and I promised to get us back on track here in terms of time. So how many, okay, now we're going to work with the folks. How many of you are fixers? So if you will allow me to paraphrase an old wine commercial, even though many of you are substitutes, we serve no advice before it's time. We offer, there is a role. In earlier versions, the thought was if you could resolve the ambivalence, all you had to do is point the person in the direction they would go there. And I won't go into the details. But the bottom line is that in the research is that providing education, information, et cetera, I mean, we couldn't imagine the apps that are out there now to help people manage their money, the apps that are out there to help folks do a variety of things, or the services in the community. And so education becomes important. And so this is just a list of times where it's appropriate. So if a person asks you for advice, but of course give it. But we give it, research tells us how we give it will directly impact whether they receive it. Because how we give it, well, so that's actually, so the formula is ask, provide, ask, but it's actually ask, ask, provide, ask. And sometimes the first two are switched. Because sometimes, Cheryl, people have already told us what they've tried. And so we might summarize that and then say, can I offer you a suggestion? So I'm sorry your name is the person who keeps right behind you, Jeremy. Yeah. Hi, Jennifer. So Jennifer, so what I would say is, can I offer you a suggestion? Sounds like it'd be okay if I gave you some ideas. I always encourage people when I'm coaching folks, Jennifer, that you don't want to sound like the MI parrot. Can I give you some advice? Can I give you some advice? Can I give you some advice? Mix it up. Just, again, there are lots of ways. Ask for permission. It supports autonomy. It's consistent with the spirit of MI. Ask what they already know, and then offer it in small chunks. For those of you who are trained to work with kids, you know that you only give 1 or 2 suggestions at a time. And then say, well, what do you think about those suggestions or those ideas? You can always do the provide-ask cycle over and over again. All of us have had that handout, Ronsalind, that says 101 ways to stop using alcohol and drugs. And you go, I don't know which one. I have no clue. So that whole sense of limited options always work better, and then asking for feedback. And so that's the ask, provide, ask. Decisional balance, I'm going to talk about a couple more things that are just very specific MI conversations you can use. Decisional balance. How many of you use pros and cons lists? So there's a problem with pros and cons lists. Bill Miller has done a lot of research in this area. The problem with pros and cons lists is you could actually have people arguing equally for change and not change. And people are just as stuck. Anybody who's worked with domestic violence knows that. Why do you stay in this relationship? Why should you get out? Why do you want to get out? And so we are very specific in when we do decisional balance. Because only 2, if you're familiar with the 4-quadrant model, there are only 2 quadrants that have change talk. What would be the benefits of not gambling? And what will continue to happen if you continue to gamble? And so it's really a one-sided teeter-totter. And so that, in other words, when we do pros and cons, we ask the benefits of change and the negatives of staying the same. We don't bother with the other. The only time we bother with the other, and the research does tell us sometimes it is helpful, if the person's not motivated at all and you're trying to get some cons, then it might be useful. But generally, this is how we do decisional balance. I have the instructions for this. Jeremy, this is the thing we were going to do the practice on. We're not going to do it in deference to the time, and also the folks at home who are tuning in are not able to engage in this. So the instructions are there. This is a complete change talk conversation. It's called Why Change, Two-Path Solution, or Querying Extremes. And so what I'm trying to do with this, and it's also visual. So when I use it as a visual tool. It's a big open Y with a positive, a negative on this side and a positive on this side. And so a lot of times what I'll do is I'll just sort of summarize the conversation about what got you to this point. And if we did this exercise, we would be doing a real play about something that you're thinking about changing. And kind of, I might ask you a question, Cheryl. Well, what's gotten you to this point? What's kind of been happening over the years or recently that's gotten you thinking about this? What I would get is the negatives of the status quo, wouldn't I? And then I would say, where will you be 6 months from now? Now, the time frame becomes important, Jeremy, because if I'm working with persons with a serious mental illness, the life cycle of a person with serious mental illness is, when do I get my check? And so if I'm trying to help them stop betting on the lottery, which is a common one with folks with schizophrenia, I'll say, where will you be a month from now? If you don't change. And I always go the path of negatives of the status quo first, because what I'll get is change talk of the negatives of the status quo and how things will have gotten worse, Curtis. And then I'll end up on the positive. Let's be optimistic, Cheryl, that you... Huh?
You also have a recency effect, too, by using the positive last.
Yeah.
Because it's stuck in your head.
Yeah. So again, how we respond makes a difference. So these are the instructions for the real play. A couple of other things, looking backwards, which is you can use this as an affirmation tool, or you can use this as a negative as a status quo. Sometimes our folks, like I've worked a lot over the years with folks who in their middle years, maybe when they retired, took the senior trips to the casinos. And their life was pretty okay. And so that's a restorative conversation. So looking back, or what's it like since this is a problem. Exploring values. By the way, there are several values card sorts out there. This is my favorite, not the one, and this is sort of sacrilegious, it's not the one by Bill Miller. This is by Moyers and Martino. What's important in my life, a values card sort for persons with schizophrenia. Even if you're not working with schizophrenia, what I like about this card sort is that a lot of our clients deal with very concrete issues. They're not thinking about esoteric. On Maslow's hierarchy of need, Cheryl, it's right here at the bottom. Basic stuff. And so I like this one. If you don't like the card that says not here voices, throw it out. I also use it a little different. I use it as an affirmation. I sometimes will say, what's really important to you, Jody? And I'll say, which of these are you having some success at? And so again, using it as a positive and saying, which of these are important that you're not doing so well? So that's the values, the miracle question. A lot of folks might be familiar. Here's the one that I use. By the way, some colleagues of mine in northern Indiana that I've worked with over the years have actually developed a values card sort. There's no standardized one for children and adolescents, but they have a very nice one. And they use as a way of kind of looking at values. Here's the reference to the one, the strengths, and I use it very similar, which is to the other values card sort, is have people identify their strengths that will help them make these changes. Agenda mapping for a lot of our clients have high complexity. They have multiple problems. They don't come into treatment, or they don't call a crisis line until all hell's broke loose frequently. And so What this is, this is again another one of those visuals, which is you can do a bubble picture. I like to use sticky notes. Put one problem on each sticky note, and won't go into detail. The idea is then I can kind of say which of these are most important to you, which of these might you have some success, and it goes with strategy mapping. We're not going to do this exercise just because it allows. So again, people are ambivalent, and we hear change talk and sustain talk. An example of thinking about this is, again, how we respond is to soften sustain talk and strengthen change talk. So we're selective in our responses. So if a person, these are common things that I've heard. I know I should stop gambling, but I don't know how I'll get out of debt if I don't make up for my losses. So again, you can think about a double-sided reflection, or you can just ignore the second part and say, sounds like you know you need to stop gambling. This could be one of those amplified reflections. There is no doubt in your mind that stopping gambling is the most important thing you could do right now. So that sense of, this is my metaphor, which is, that's what my garden looks by midsummer when my motivation has waned. It looks like the high desert in bloom, mostly weeds and a few flowers. And that's the way change is that a lot of times our clients have lots of problems, and we're focusing on picking flowers. This is some ideas about when it comes time, when you have enough change talk, you offer a summary, and then you start planning. This is when we oftentimes give advice with permission. Identify barriers. And so I didn't say we ignore the sustained talk. I oftentimes reframe the same sustained talk, which is we'd have to figure out ways of you to get out of your financial situation, problems, so that to help you stop gambling. And so that sense of I reframe sustained talk oftentimes. And I won't get to, if you'll give me grace for just a couple of minutes, because I don't want to miss managing discord. In earlier versions, they called this rolling with resistance. And what we understand, or what the research told inform Bill Miller and Stephen Rolnick, is that we are perfectly capable of screwing up a good conversation. And that it isn't always our clients who are resistant when things don't go well. And so we manage discord in the same way that we manage traffic lights. You know, sometimes we're on the track and we proceed too fast and try and run that caution light and get red lights. We push too hard. And so it's the interpersonal process. This is just some suggestions about things that we can do differently, which is what's called the writing reflex. So sometimes our clients will talk change and not change, Brooke. And because we're champions for change, we go at it too hard, and it's called the writing reflex. And the natural response is to throw up the walls. And so, or as one of my favorite artists who died from COVID, John Prine, said, there's nothing louder than the voice inside my head. And so if you take up the side of change prematurely, called the writing reflex, what you get is sustained talk. So we have to be careful. The question and answer trap, which is, again, we get into this trying to get information, not by open questions, but and conversations. And just mindful of cultural differences, values differences, etc. And then client-generated discord. And maybe I'm the only one who's had a client ever argue with me, Ronson Lynn, what do you think? Or interrupt me, or challenge me, or ignore me, or just be openly hostile, or that's just a bunch of shit, right? Yeah. Anyway, that's client-generated discord. And that's different than sustained talk. Sustained talk's about the behavior. Discord is about directed at you. You don't understand. Have you ever had a gambling problem? How are you going to help me and my situation? Which is, and we get defensive about that because we want to be helpful. So I'm just going to give you a brief, quick steps through managing this, which are not MI in the beginning, which is ask yourself if you're in physical danger. Obviously, because again, the profession we have is that we do have folks who are desperate. So am I physical danger? Most of the time I'm not. Just always maintain a safe distance. Everybody, along with me, take a deep breath. This is a mindfulness technique. Our natural response when we're under attack is to fight or flight. So just take a deep breath, because a lot of times the discord just goes away just by taking a deep breath and not responding. Just letting them vent a little bit. The next, so that's your mindfulness instruction. The next is a cognitive, which is on your next breath, say, this isn't personal. It's not about me. Now you might be able to use am I. And just say, wonder with compassion what's going on. And again, on the crisis line, it's like they're desperate. The world's coming to an end. They see no tomorrow. And it might be targeted at you. And it really is about, I'm desperate. I am at my wit's end. I don't know if I'm going to live tomorrow. And and then the response. I've already talked to you about how to respond. Just use a reflection. You're feeling desperate. You're scared. So reflect the feeling or situation. And again, again, we don't have time for this, but this is really about 2 slides on talking about, so I grew up on a farm and quilting was part of what we did. So this is really about blending and integrating. And there are a couple of slides in here. Like I said, you're welcome to them. You have copies of them. This is really elements of MI that fit nicely with others, or as my last metaphor is, it plays nicely in the sandbox with others. And some resources. That's me, backbren90@gmail.com. Now, if you do send me an email, though, it's a shared email at Continuing the Care, and you will get a response back from Candace Backer. So if you get a response from Candace Backer, you say, who in the hell is that? It's my business partner. So she set it up. Her name got on it. All right? That's just how it went. All right. So if you have any questions or you want PowerPoints, and I'll be outside or hang around while break if you have questions. And I think I'm having a separate meeting here in a minute. Yeah. Anyway, thank you. And thanks for the work you do.